Welcome back to the News at 9. In today's Health Yes segment with Genesee Health Plan, we're talking about Colon Cancer Awareness Month. So joining me now, oncologist Dr. Rizwan Danish and Jim Milanowski, President and CEO of Genesee Health Plan. Thanks to both of you for being here.
Good morning.
Good morning. You know, our first question, we talked about March being Colon Cancer Awareness Month. What is colon cancer, doctor, for those who don't know the specifics of it?
Okay, colon cancer is like a tumor that develops in the colon, and the colon is the last part of the bowel. So the bowel consists of, once the food past the stomach, it goes into the small bowel, which is the large part, the longest segment of the bowel, and then the last part of the bowel is the large bowel, which is mainly responsible for concentrating in the stool and taking out fluids back into the body. That area is prone to develop cancer, and the cancers usually arise within the inner lining of the colon. And what happens is some of the cells, one or a few of the cells, lose control. The DNA becomes abnormal and becomes autonomous and begins to grow on its own without listening to the checks and balances that are already set there, and becomes its own kind of creature that grows inside an individual.
Now, what are the signs and symptoms?
The most common sign is a change in bowel habits. So if somebody's used to having regular bowel movements and all of a sudden they feel more constipated and they're having difficulty going, or sometimes diarrhea, that oftentimes is an early sign. The other sign would be finding blood in the stool or having black stools can be a sign. Somebody who may present with anemia, because oftentimes if these tumors grow very slow, and sometimes they could be there for over a year, there could be small amounts of blood loss, and they can become anemic, they can become deficient in iron and anemic. And then some people rarely present with catastrophic signs, with severe abdominal pain, which ends up to the hospital with really catastrophic signs, and they have to have surgery right away.
Well, now, how is colon cancer diagnosed and treated?
Usually, for most patients, colon cancer is found early thanks to screening. And so it's diagnosed by a colonoscopy, which is the most common way it's found. And then once a colonoscopy is done, they do a biopsy to confirm cancer. With the confirmation of cancer, then patients generally undergo a CAT scan to see how extensive the cancer is. And generally we find it early now, and they go to surgery, and the most common treatment right now is surgery for the early stage colon cancers.
Sure. Now, Jim, I want to ask you, why is this important to Genesee Health Plan? We've always talked about prevention with you guys, and that's sort of what all of this is centered around.
And I'm sure we'll talk about that on Facebook Live, that this is a preventable disease. If we can get it early, detect it, screen it, and take care of it through the colonoscopy or other, then we don't have to have a long-term impact of having that cancer or trying to deal with it. And that's exactly what the health plan is always advocating, is to prevent something from really occurring. You almost can pay me now or pay me later. And we'll talk about the colonoscopy. I had one last year, and so we'll talk about it on Facebook Live. We're doing a little tease here.
We're going to talk about Jim's colonoscopy on Facebook Live.
Exciting stuff.
You're not going to want to miss it.
No, you don't want to miss it. But it's not a fun thing by any thing, but it's really, it helps prevent this illness from taking place.
And I know that you would say that drinking that stuff and going through the process, not fun, but it's definitely worth it.
Oh, it's well worth it.
Yes.
The procedure itself, usually people are anesthetized and they're knocked out, so people don't notice it. But it's the prep, the drinking that stuff that can be a little bit difficult. But it's really minuscule compared to the advantages that
saving your life
provides you.
Absolutely.
All right, thank you so much to both of you for being here. And as Jim mentioned, we will be live on Facebook, on WNEM's Facebook, after the News at 9 here. We'll be answering your questions, and then for more on today's topic, you can always visit WNEM.com.